Welcome to today's we're brought to you by OraSure Technologies and Red Planet Substance Abuse Testing. Technologies is a global leader in oral fluid substance abuse testing products. Their assays provide accurate and easy-to-administer testing methods to help determine the presence or absence of drugs or alcohol in a person's system. Fluid-based testing products provide a simplified collection process. As a result, cost savings, minimal risk of tampering, and dramatically reduced risk of adulteration. The Intercept Oral Fluid Drug Test is an FDA-cleared laboratory-based oral drug testing system that enables accurate testing for 9 drugs of abuse, including marijuana, cocaine, PCP, amphetamines, methamphetamines, barbiturates, benzodiazepine, methadone, and opiates. It was as the #1 recognized brand name in oral fluid testing in a 2014 National Drug Testing Industry Survey. With a fast and easy-to-administer collection process, it is ideal for the workplace, criminal justice, drug treatment centers, clinical setting, screening settings, among others. Is entitled What Employers Have to Say About Lab-Based Oral Fluid Testing and will be presented by Bill Current. Bill is the president of the Current Consulting Group, a national consulting firm that specializes in drug testing policy development and helping employers optimize their employee screening program. He's editor of the online Ultimate Guide to State Drug Testing Laws at statedrugtestinglaws.com. He also publishes the e-newsletter State Drug Testing Laws Monthly. Mr. Current is the former executive director of the American Council for Drug Education and served as vice president of consulting for National Third-Party Administrator of Drug Testing and Background Screening Services. He is or co-author of 10 books on substance abuse issues, including drug testing. He administers the annual Drug Testing Industry Survey, now in its 17th year, this of which will be presented at the STAPA conference in September 2015. It will now be our pleasure to hear from Bill Current.
Well, Tika, and welcome to everyone who is on today's webinar. First, I'd like to just acknowledge OraSure Technologies and Red Planet Substance Abuse Testing for co-sponsoring today's presentation. Everyone who's on today's presentation will receive a link so that you can find today's slide presentation. And in addition to the information that you saw on the screen earlier about OraSure, you'll also find some background information about Judy Swartley, the president of Red Planet Substance Abuse Testing and Red Planet Substance Abuse Testing. So thank you to both of those companies for helping to make today's webinar presentation possible. We're going to talk about lab-based oral fluid testing. I'm going to provide introductory remarks based primarily on the proposed guidelines that were recently issued by SAMHSA, by the Substance Abuse and Mental Health Services Administration, for lab-based oral fluid testing, and we'll use that as a way to sort of lead into some interesting accounts of lab-based oral fluid testing that my co-presenters today are going to share. I have 3 co-presenters. Each of them is an executive or a supervisor manager with a company that's lab-based oral fluid testing, meaning not a drug testing provider. They're an employer or a company that uses lab-based oral fluid testing. So we'll talk about lab-based oral fluid testing from the perspective of a real-world application of this testing method. And I think you're going to find that interesting. I will presenters as I bring each one of them into today's presentation. I think many of the people who are on today's call perhaps are from the drug testing industry. Others are employers who either do drug testing or are considering implementing a drug testing program. The most thing to know when it comes to drug testing is that drug testing works. It helps people who have a drug problem. It helps deter other people from using drugs. And for employers is hopefully a safer, healthier workplace. Someplace where your liabilities are protected and minimized when it comes to unsafe behavior in the workplace, most companies that have introduced drug testing over the years, and of course there are many thousands of companies in the United States that do drug testing, and the world as the popularity of drug testing has spread around the globe. Many of the companies that have implemented drug testing, either company choice or in compliance with federal government or state government regulations, have decreases in what I call the key indicators of employee substance abuse: rates, workers' compensation claims, health care costs, health care benefits costs, lost productivity due to absenteeism and tardiness and things of that nature, and even perhaps employee theft and workplace violence. Many of those types of behaviors or key indicators are related to substance abuse, or they're magnified, if you will, by substance abuse issues in the workplace. And so drug testing can have a direct impact on those key indicators. The question is not whether or not to do drug testing. We're not into the substance abuse in the place industry, drug testing. Back in the 1980s, early 90s, the question really was, should companies do drug testing? Should they have drug testing programs? That question was answered a couple of decades ago. Now we're really looking at a sort of a more targeted type of question. Which type of testing method is right for your company? And there are many different methods. Now, the traditional historical way of doing drug testing is collecting a urine sample, sending it to a laboratory, but there are alternatives, even perhaps advanced testing methods that are worth considering and maybe using in your company. Now, if you've been doing testing for any amount of time, you know there's a process involved there, and it takes time. You, an employee or an applicant, will be sent to an off-site collection facility where we will void a urine sample. That takes time. Then the sample is transported, usually by overnight delivery, to a laboratory. That takes time. The lab conducts the preliminary screen. If the result is non-negative, the lab does a confirmation test, or in other words, if that initial screen is positive, if it shows the presence of one of the drugs that you're testing for, the laboratory will perform a confirmation test using a different testing technology. And it's confirmed positive, it goes to the medical review officer to verify one way or the other, and then once it is verified, it gets reported. That entire process, all the steps that I just described, take time, and they cost money. So it starts on the left of your screen there with send the individual to the off-site collection site. 1 to 2 hours. You're going to see in some of the information I'm going to provide, the federal government estimates 1 to 4 hours for typical off-site urine collection. And it goes through this process that I described. And as you can see, every step takes time and costs money. And, of course, costs money as well. So when you get the cost of drug testing, each single drug test, it's fair to factor in the time that it takes for that step to be completed, because the time is costing your company money. And so I'm going to have these slides. You can go through this in a little bit more detail so that you can examine the different steps there. Lab-based fluid testing, some of those steps. And I believe it's growing in popularity because, for one thing, it's not urine. There are some people and some companies that are philosophically opposed to collecting a urine sample and examining it. There are companies that don't want to go through the cost that's associated with the time that's associated with it. Many struggle with the proliferation of various drug test cheating products and methods, and urine testing is particularly susceptible to these cheating methods, and you can find all the information you want about drug test cheating on the internet. In fact, if you do on the internet, do a Google search on drug tests. Just type in beta drug test. You will get over 1 million different possible websites that you can go to, information or products that you can purchase that promise to help you beat a drug test. And they're almost all related to urine testing. Lab testing is very, very difficult to cheat on, which I'm going to share some information on that, and so will my co-presenters. lab testing renders accurate results that are comparable to based urine testing. ACEs, the positivity rates with some companies are actually higher. But importantly, in terms of what companies are looking for, it reduces the time it takes to conduct a drug test, and that is contributing overall cost savings to each and every drug test that you conduct. These different advantages, or let's just call them benefits, specific to lab-based oral fluid testing, and I'm saying lab-based oral fluid testing. I want to emphasize that at least for today's presentation, we're not talking instant result oral fluid testing specific or to any extent. We're talking about lab-based oral fluid testing. The reason is that the federal government has proposed guidelines. SAMHSA has proposed guidelines for lab-based oral fluid testing, not for instant oral fluid testing. So the government is looking to expand its own regulations to give federal agencies at this point the option of using lab-based oral fluid testing and lab-based urine testing. And these proposed guidelines came out back in May and basically cover 5 things. They're proposed standards and technical requirements for the collection devices, the various oral fluid collection devices, and the initial oral fluid drug testing, drug test, the confirmatory test process, and the application of the medical review, the process for the review by the MRO, and then a 5th category which deals specifically with federal agencies that will have the option of using lab-based oral fluid testing. Now let me sort of clarify that. The amount would actually only apply to federal agencies. In other words, the drug testing of federal employees. The process that exists in the current regulatory guidelines, except for the areas that would be specific to oral fluid testing. But when I included this as a direct quote, took the proposed guidelines. These proposed oral fluid mandatory guidelines, that's what OFMG stands for, provide the same scientific and forensic supportability of drug test results as mandatory guidelines for federal workplace drug testing urine, or the URMG. I thought that a very telling statement from SAMHSA. In other words, they have just as confidence in science and the technology behind lab-based oral fluid testing as they do with the science and the technology that's behind the existing urine mandatory guidelines. These guidelines, once they are finalized, and they've gone through a 60-day public comment period, now the feds are looking at those comments and deciding whether or not they want to make any changes to the proposed guidelines, et cetera. But once finalized, they de facto establish sort of a gold standard for oral fluid testing. They apply as to federal agency drug testing. However, and using the right out of those proposed guidelines, quote, some agencies such as the Department of Transportation are required to follow these guidelines in developing drug testing programs for their regulated industries, whereas others, such as the Nuclear Regulatory Commission, use guidelines as part of the regulatory basis for their federal drug testing programs. So essentially what SAMHSA is saying here is that once these proposed guidelines are finalized and are in place, and will include everything from collect procedures, the lab testing process, the clearance of collection devices and assays in the laboratory, et cetera, et cetera. Once all of that is finalized, it will be available, or lab-based oral fluid testing will be available to federal agencies that do drug testing. But once DOT adopts lab-based oral fluid testing, regulations would automatically cover the final guidelines once they are finalized. OSHA conference a month ago or so, excuse me, DOT speakers, folks from DOT, talking about the various DOT regulations. And Patrice Kelly, who is acting director of ODAPSI, indicated they are interested in looking at these guidelines once they come out. She did not admit how to, implementing or proposing to implement lab-based oral fluid testing. Really didn't have to. At least I'm sharing with you my opinion from been made by DOT representatives, and just by virtue of the fact that SAMHSA is heading in this direction, we can assume that at some point DOT will adopt these fluid guidelines as well, and companies mandated under the federal under the SAMHSA, or under the DOT regulations to do drug testing would have the option of using lab-based oral fluid testing as well as urine testing. And if time at the end of today's presentation, I'm going to share some projections for the number of drugs that will convert to oral fluid testing. In other words, in the guidelines, they project how many drug tests will become oral tests instead of urine tests. And also with you, but as part of those projections, they also projected what DOT tests will actually become lab fluid tests as well. I find that interesting. Also, towards the end, slides are just statement for each different benefits that come right out of the SAMHSA proposed guidelines. I have a lot more information on every one of these: accuracy, science, drug test cheating, recent use indicator, and as you'll see on the next slide, productivity and savings. A lot of information on each one of these. At the very end of today's presentation, we won't get into that, but I've included those slides in the slide deck after what is our normal concluding slide. So when you get these slides, you'll be able to view the expanded slides on the benefits of oral fluid testing. But that's what we're going to talk about today, the benefits of lab-based oral fluid testing. This is saying and published in their proposed guidelines. What I love about it is the fact that, and in the drug testing industry know this, I've been talking about lab-based oral fluid testing for years now. I'm a proponent of all types of drug testing as long as it's done right. But I'm a proponent of lab-based oral fluid testing for many years because I could say there were a lot of companies that were perhaps hesitant to do drug testing because urine testing just didn't fit with their corporate culture, cost-wise, it didn't fit within their budget, et cetera. And I saw this as an alternative worth consideration over the years talking about oral fluid testing. But proposed, rather than quote me, just go to these proposed guidelines and quote the federal government, because they have articulated all of the advantages or benefits of oral fluid testing, and they've expanded on it. So you'll find a lot of information that they refer to substantiate some of their claims, and these are the very reasons also decided to go ahead and put proposed guidelines for lab-based oral fluid testing. And these proposed guidelines have been in the works for a long, long time. And so, years in the making, they finally got in May, went through the public comment period, and will be seeing a lot of information about lab-based oral fluid testing go forward, even though it will take some time now before they actually finalize those proposed guidelines. Many companies have already started looking at oral fluid testing as an viable alternative. I know this because we conduct a survey of the drug testing industry a year. This will be the 17th year of doing this survey. And we've seen the growth of lab-based oral fluid testing in terms of the number of companies in the testing industry indicating that they're selling more of lab-based oral fluid testing. We've seen the results of our survey. It's not just that these proposed guidelines are going to result in companies more doing it. A lot have already started switching from some other testing method to lab-based oral fluid testing, or merging a lab-based oral fluid testing with an existing urine testing program, for example, and getting the best of both worlds. So I have with me three co-presenters. I'm going to introduce them one at a time and give them each a turn to talk before I introduce the other one. My first presenter is Sean, who's the Director of Safety with the masonry contractor, large company on the East Coast, with up between 400 and 500 employees. Now, Sean, has your phone been unmuted?
Yes, sir. Thank you.
Great. Thank you, Sean, for joining us today. We had the opportunity to talk to Sean on a couple of occasions in detail about his company's drug testing program. And with all of our co-presenters, I think it would be great, Sean, if we could just start out by asking you, tell us a little bit about your company and about your company's drug testing program and how it is that you ended up doing lab-based oral fluid testing.
In multiple states, Bill, and we're currently doing oral drug testing for pre-employment and post-accident drug screens. It's a benefit to us being spread across a large area. It's much easier for me to be able to conduct the test than it would be with a traditional urine screen test.
Now, you mentioned that you cover a large area, several states, and that you need to do a large number, say 10 all at one time. You need to test 10 people. You can actually get that done yourself very easily.
Sir, that's much, much easier than stated the traditional urine screen, where you have to try to look for a restroom, or, for instance, if you have a job site and employees of that site are going to be sent to another site within the coming weeks, and they have to be drug tested within a certain amount of time, and they need to be retested. You don't go out to look for the restroom or the porta-john to test them. It's just as simple as to put a vehicle or go to an office at an office trailer on site, and you can take care of them. The time frame is greatly reduced by doing that. And with that, you also cut down on tampering with and of the test itself.
Tell me a bit about adulteration. Has oral fluid impacted people's efforts to try to cheat on a drug test?
I heard a good deal. Be surprised at how many people that come for a drug test for orientation, a new hire, that is a surprise to them when they are faced with a drug test. So I've had some who have gotten up when they opened their test up or shortly after they took it, said they had to go to the restroom and got up and left. So it's really impacted that. I've been in this business for a long period of time, and as you stated, there's multiple thousands of things out there that you can do to try to cheat on a test. And with these tests, it's almost impossible to cheat on these tests with experience that I've had with them.
You mentioned that you do pre-employment and post-employment. Did you also mention random testing? Okay, so employment and
post-accident, yes, sir.
Okay. What's been your experience in terms of positivity rates compared to your past experience with urine testing? Or is it about the same, a little bit higher, a little bit lower?
It's slightly higher with the new oil-based drug testing than what it was compared to screen test.
What do you attribute that to?
To adulterate or cheat on the test.
In your opinion, you're getting a slightly higher positivity rate with oral fluid testing, really to the fact that it's harder, if not impossible, to cheat on the oral fluid test.
Exactly, yes, sir.
Okay. Now, if talking to a counterpart with another company and they were hesitant to do oral fluid testing, what advice would you have for them? I don't want you to be a commercial for oral fluid testing, but talking to one of your contemporaries, let's say, and they're expressing, concern about switching from what they're comfortable with to a different testing method, what would you say to them?
The selling point, there's a few selling points, Bill, that goes with these tests. Number one is it's easier to administer. Number two, you can do multiple tests at one time. Three being the big thing, the hygiene issue and handling the urine screen cups. Four, and the big thing which all companies hit on constantly is the essence of time. with the additional drug screens, yes, they are instant tests, but are you really getting a true test back on that employee? And if the oil-based oil fluid test, we do them here, fix them out, and within 24 hours, we have the results back. It's a time expense. They're much easier. That's a much cleaner drug test to use. That's the point.
Okay. And we'll come back to you a little bit. I want to bring in our next co-presenter. Sue is the occupational health manager for a large paper manufacturer, 700 employees. And Sue, is your phone unmuted?
I'm here.
Great, Sue. Thanks for joining us today. I'm sure you probably have some things to say about lab-based oral fluid testing, as did Sean. Let's just start out by having you tell us just a little bit about your company's drug testing program, how it that you ended up using lab-based oral fluid testing. I think you do a combination of different testing methods, don't you?
We're a large manufacturer with about 700 employees, 85% male population, with 2 female nurses in facilities. So the used to do oral urine testing, send employees out to action site. We did pre-employment and have a DOT population as well. I sent everything out. When I came on board 5 years ago with 2 females with a male population, we were doing the drug screening on site and had a share of issues, which everyone has with urine testing. And I introduced the oral fluid testing to my company from a former company. They were doing the oral lab test, and our HR team always wanted to introduce a random program, but they could never. We are represented by 4 very large unions and 7 total, and so they'd never get past the union officials saying, you know, want to use urine thing, and they didn't really know about another method, so they could never get that process through. And once I introduced the oral fluid test, because of the window of detection being smaller, they bet, and we now do random testing for our total population, DD testing, pre-testing, post-incident testing, and reasonable suspicion.
The process that you went through in negotiating random testing with your union?
To get the unions to understand the whole process and what we were trying to do, which you have mentioned, the decreased cost, safe environment, we wanted to give them a chance and an opportunity to truly understand the oral fluid test and the whole drug screening process. So we, our customer service rep, who came and did like 4 informational sessions with our union officials, allowed them to ask questions, allowed them to take a test, to see what it was like, to understand how it was packaged and sent to a lab, what the windows of detection were for each drug. And they really had a hands-on experience before they agreed to say, okay, we'll have members be a part of this.
Okay.
It's a long process.
It's to make that happen.
Yes.
And what has been the union's reaction to random with the oral fluid?
Well, everyone has accepted the random program. We're all subject to it, all 700 people, whether you're union or non-union. It works wonderfully because what happens is we have a third-party administrator who chooses our names. We do the test. We call the supervisor. We say we need to see John Doe today. He brings John Doe to the office. 5 minutes we do the test. The employee back to work. There's no, you have to do a random test, so we have to put everybody in a car, bring them to the test collection site. You know, maybe they can provide urine sample, maybe they can't. So we're talking about a long period of time that we could have been on for a urine test as opposed to a 5-minute test that happens in the office. Read everything up, send it out. It's a simple method. It's really easy, and I think it's been well accepted by every managers, supervisors on the floor, the employees, everybody has. It's wonderful.
Sounds like it's working then, and the integrity of the program is not really challenged then.
Now, I think it's actually more restrictive, if that's the word I'm looking for. But I think it's an accepted procedure. No one wants to, for example, there's, if you have to, but there's something about having that urine sample, and we random testing 20% of our total population in the course of a year, which is pretty high. So people intimidated, they didn't like the urine test. It's a harassment, maybe, I'm not exactly sure, but it's uncomfortable, I should say. But the fluid test, using the test, it's very simple. It's not at all intimidating. We ask people if they want confidentiality. We take it to an exam room. If they don't, it's done at a desk in an office. Very simple.
So our audience members today asked the question about, certification of collectors, which is, something that's an important part of the urine testing process. And of course, keep in mind, we don't have finalized guidelines or regulations for lab-based oral fluid testing or the collection process yet. But what kind of training did you and the nurses who work for you receive in order to administer these collections?
Well, our rep, and there's also a CD, and talks all about the collection, how it's done. You ask the employee to participate. The employee or the person being tested actually administers the entire test to themselves. And the collector as the presence to shine the chain of custody, package everything up. But it's very simple method. So the employee or the one being tested, the whole test themselves. And the CD from OraSure that they provided, at the end of that CD, there's questions that you have to answer and a certificate that's printed that said you are the one knows how to do this collection. We, once a year, have everybody that's been certified do the test once, or just to be, didn't use them that year, they might not remember.
So people in your company who do the collections, who are I am in there standing right there in front of or sitting right next to the person, the donor, right? So always within eyesight of each other.
Correct.
In case these are our professional nurses, necessarily supervisors out on the floor.
Well, interesting point. We have the 2 nurses. We administer the random program. We are responsible for the entire program. There's a post-accident and it's off hours. We trained our personnel to do the collection as well. Again, it's the same. Use the video, you questions, you print the certificate, and then they've asked that we watch them do a couple of tests. We are with them, so in case they have any questions. I have a whole collection room for off-site hours that's also used for something else during the day. But it's, I have everything highlighted on the chain of custody, the actual procedure, which is very simple, a one-page laminated information sheet. We have test kits locked up. They just go in the locked box. They choose it, they do the test, they lock it back up. We send it out the next day.
Okay, very good. Kind of final comment you would have. How about the question I proposed to Sean? I mean, if you were talking to one of your professional counterparts at another company, what advice would you give them if they were contemplating oral fluid testing?
Ease of use, I think. You had asked Sean about the positivity rate, and I think we have seen ours increase, again, because of the adulteration of urine samples. And now we have the increase, of course, in the random testing, so we're going to see a higher number. But ease of use, I think, and just the acceptance by more people of just seeing a cotton swab in your mouth as opposed to, well, now you have to sit here and drink out fluid so that you can provide a urine sample. It's just much, much easier, much cleaner, cheaper for those of us who are female working in an almost total male population.
Okay, perfect. Thank you. And I think
Thank you, Bill.
Oh, yeah, and stay close by. We might have some more questions for you, Sue.
Okay.
I think it's important to point out to the audience before I introduce our third co-presenter that the proposed guidelines do reference a 10-minute waiting period prior to collecting an oral fluid sample, and that is about the amount of time that it takes for the saliva to sort of clear itself, or saliva sort of clears itself after about a 10-minute period, food, drinks, anything that might be in the mouth. That's part of the proposed guidelines. Now, one of the challenges that exist today, and these proposed guidelines would address this as they de facto become the de facto standard for oral fluid testing, is that most state laws don't even touch on any of these types of details. So many state drug testing laws were written prior to the advent of lab-based oral fluid testing, hair testing and instant urine testing, etc. So you don't find a lot of details about those testing methods in most state drug testing laws. Some states have added them, like Georgia, for example, with its workers' comp premium discount law. They've actually gone in and provided information that relates specifically to oral fluid testing, but you don't find a lot of that. So a reference in the proposed guidelines from SAMHSA of a 10-minute waiting period prior to collecting an oral fluid sample is that you won't find in state laws, but many states defer to the quote-unquote federal regulations, which these will become part of it at some point. And this question, the waiting period question, and many others which are not covered in state laws would be answered in the future federal regulations when they come out. So just I'd address that real quick. Now, go to my third co-presenter today, and we're real good on time. I want to bring Kurt in. Kurt is the Director of Human Resources with the Continuing Care Retirement Community, and I see we have a title on that, Communicity. He 125 employees. Kurt, you with us? For agreeing to be a co-presenter today, Kurt. Maybe you could start also by telling us a little bit about your company and your company's drug testing program, and then in my conversations with you, there were a couple of interesting anecdotal stories that you shared with me that I'd like to ask you about. So maybe start by telling us a little bit about your company's drug testing program.
Sure. Good afternoon, everyone. Dunwoody is a 425 employee continuing care retirement community based just outside of Philadelphia. And nursing homes in Pennsylvania are very heavily regulated. In fact, the second most heavily regulated industry in the state, just after nuclear power plants. The drug testing component of our hiring process is incredibly integral to the success of our HR program. And historically, we had used a typical kind of program that many employers use, where applicants simply go to a lab and they do the urine testing program, and it's an arduous, cumbersome, and we were looking for a method to streamline our process. And we weren't necessarily looking for anything that had to do with cost cutting or anything like that. We wanted to streamline the process a little bit. We are about 100 employees per year, and they have to go through everything from Pennsylvania State Police background checks to FBI checks to references to drug testing programs. So that was really the impetus for us to see how we might be able to streamline our overall process, and that's where we were we were fortunate enough to locate Swartley and went program from there. So we're very pleased with the program so far. It has definitely met the goal that we wanted to meet, which was to stream that process. So we're pleased.
Okay, so Kurt, let me ask this question. You have different types of people who work for you. I mean, you've got registered nurses, all the way people who are cleaning rooms and working in the dining center, I suppose. It's sort of the full spectrum, right?
Correct.
So RVNs, et cetera, they would be used to meeting certain professional requirements for their licensing, et cetera. How has lab-based oral fluid testing been accepted by those people versus other employees who maybe are not as don't have this type of licensing requirements? But sort of universally accepted, everybody's pleased with it, or have you run into any challenges?
Run into our nursing staff at all. Probably because they have seen how we were able to increase the amount of time it takes for them to get somebody through the application process. So there has been no clash at all from any of our nursing staff.
Okay. So they're going to be drug tested or that have to meet certain types of licensing requirements.
Absolutely.
One of the interesting things that you shared with me, you told me there were 3 key factors why you wanted to switch to oral fluid testing. Number 1 was to introduce what you called the element of surprise, which we'll come back to in a minute. 2 was, I thought it would be interesting, to make the process less cumbersome for applicants. What do you mean by that?
It's because applicants have to jump through so many hoops by the organization. We really wanted to find a way to bring it in-house as we possibly could. We're already at the mercy of, say, the FBI to process a fingerprint clearance as quickly as possible. That can take sometimes up to 4 to 6 weeks to get processed. Typically, our Pennsylvania State Police background checks come quickly, but sometimes they don't. That can be based upon the fact that somebody may have a very common name, last name Smith, last name Jones, something like that. So it's in place that can really make the hiring process so much more different than we want it to be. So those aspects of the hiring process are our control. The testing process, where somebody would have to go to a lab, and we would give them to 72 hours after they came in the HR office to their kit and go to a lab and have done. And sometimes they would forget, or they got busy, or you think of any reason you can think of, and we would have heard it. So this was something where we were able to gain more control, ownership over the process. That's incredibly appealing to us.
Okay. Now, and the number 3 reason you gave, which I'll just mention, was that there is some cost savings. You told me it wasn't the primary reason why you did it, but I've experienced some cost savings. Is that correct?
Yeah. Again, it was not the intent at all, but was just a very pleasant side effect of going with the oral drug testing. It turned to be a cost savings for us of about 10%. So we're nonprofit. We'll take 10% anytime we can get it.
I think all of the for-profits would as well. So now let's back to the number 1 reason, at least in the order that you presented them to me, which was the element of surprise. You had an interesting story shared with me the other day regarding drug testing efforts. Maybe you could share that with our audience today.
The one reason for my a fit for this program is the element of surprise. And I know that Sue and Sean also mentioned that as well, but it's top of my list because we had historically known as an organization where we gave them a kit and they went out, and 48 to 72 hours later they were required to go and get the test, and then if they didn't get it, then we would get an email saying, hey, Jane Doe didn't go get her test. Red flag for us. But since we went with this new program, we have had some really interesting experiences with some applicants. And by and large, most people come in, they do the drug testing, it's boom, 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 and it's done, and the results come back, and they're fine, and they can be hired. But I had one interesting situation that occurred a couple of months ago, and it's another chapter for my book when I write a book about my life in HR. And it had to do with a young lady who came in who had applied for a position of certified nursing assistant. Viewed the DON and interviewed by another hiring manager and sent to HR to begin the paperwork process, which includes the drug testing. So I was sitting with the HR assistant who is in an office right to mine. I had my door open so I could hear a lot of the conversation that was taking place between the two of them. And our HR employee was walking her through the process of the drug testing, going to next few minutes. And unfortunately, I didn't see the look on her face, so I'm guessing it was one of utter shock because she mentioned to our HR employee that she needed to run to the bathroom. So not a big deal. 10 minutes went by, and she hadn't returned, and 15 minutes went by, and she returned. But she finally came back, and she sat down with HR assistant again, and she started walking through a story regarding her grandmother. And whenever the HR assistant saw where this was going, she stopped the conversation right away. I think you should probably go in and talk to our director. So the conversation ended. The applicant came over and sat down with me and walked me through a story in which she claimed that she had visited her grandmother the evening before, and her grandmother was ill, and her grandmother had glaucoma. Her grandmother was prescribed a medicated eye drop by her doctor, and the grandmother apparently did not like taking the eye drops via her eye, so she would put her eye drops in brownies and make brownies. And I am stone-faced during the whole conversation because I thought it was just so creative. And so she said that she had accidentally eaten one of her grandmother's made brownies than before. She was a little concerned about the results of her drug test. I thanked her for applying. I said, well, we need to go through with the thing as we conduct it, and if your testing comes back with a favorable result, then we can consider you for employment. And fortunately, if your test result comes back with an unfavorable result, you won't be eligible for employment with us. But her results came back unfavorably, so she was not hired.
Yeah, that's a good. I had to mute my phone, Kirk, because I was laughing too hard on that one.
That brought it all home for me, Bill. It really did. It was just I thought there is a great example of what went with this program, and I'm just thankful we have it.
Another, bless her heart, used to live with us, and she had to have eye drops several times a day, and I never thought to ask her if she wanted me to put drops in her brownies, to get them out. The doctor specifically said where in the eye to put them. So there were a lot of holes in that story, obviously, but it goes to the point that it's just near impossible to really cheat on an oral fluid test. And you go online and you research this, you find there are a lot of websites that offer advice on how to cheat on a test, particularly as it relates to urine. But the best advice I have found on the internet for cheating on an oral fluid test, and I when I say this to you, that the best advice I read was find a way not to let them have your saliva, because if they get your saliva, you're going to test positive. Really is no way to mask the presence of the saliva. So Kurt, thank you very much, and to Sean and Sue as well, thank you for your input and the things that you had to say. Just a couple of closing remarks as we get to the end here, and a couple of questions. I think and I know some of you, and Sue in particular, I know has deodorants, if I'm not mistaken. And are you unmuted right now?
Bill?
Do you have a DOT drug testing program also? So obviously you're using urine for your DOT program because that's the only method approved at this time. But let me ask you, if oral fluid testing at some point becomes approved for DOT, would you consider using it for your DOT drivers also?
Absolutely.
Okay. Then that's that question. Also,
yeah.
all of our co-presenters, and Sue, I've got on the line, so I'll ask you, but Sean and Kurt, if you want to chime in, please feel free to. How many of you are also doing some type of alcohol testing?
Alcohol for our DOT drivers, obviously, and for post-accident and reasonable suspicion. Not random alcohol. I was just trying to think out loud, but post-accident and reasonable suspicion.
And Kurt, I'm sorry.
We do the same here as well, Bill. The same test, reasonable suspicion, and post-accident, and of course for my DOT drivers.
Okay.
The same for us, Bill. We do not have a random program in right now. It's something that we're considering. If we go down that path, I'm sure we'll just follow the same path we have for our others. Any kind of alcohol testing right now, we sent to, it's happened one time in the year, and we decided to send that person to urgent care center for the alcohol testing.
Okay. A question to the audience, which of course I think underscores an important thing to mention, which is under the DOT regulations, you have to do saliva alcohol testing, but only as a screen. For example, you could use the QED device, which is manufactured by OraSure. There's some others, but the QED is one of them that's on the conforming products list. As an alcohol screen, if you had a positive, then you would have to confirm it, with an evidentiary breath test, let's say, for example. And assuming with the three of you, as part of non-DOT alcohol testing, you're maybe using QE or alcohol, or maybe are you still using breath? Is that your primary method of alcohol testing?
And we're using the QED method, and the beauty of that is when you have an accident where there's no suspicion that the employee's under the influence, we take and do an alcohol test and a drug test and send the employee home for 3 days. Until the test results came back. And with the QED, zero, and then have to send them on for further testing. And same with the DOT driver. So my drivers, the test is collected right in the clinic. And we have the secure bathroom with no water and the whole setup. And if we do the QED, which is the oral fluid alcohol test, if it is, then they're to go. They go back to work.
Okay, perfect. Add to that?
We on our is with our truck drivers, of course. That's the breath test where they go to an urgent care and get that done, as well as for post-accident, and the random as well. Now, simple suspicion for the regular employees, I also take them to an urgent care to be tested with a breath test as well, out of QED.
Okay.
Breath test in those circumstances.
Okay. And all three of you, just response, How long does it typically take you to get a result back with oral fluid testing versus urine testing? Are we talking basically same time, 24 hours, within 24 hours for a negative, within 24 to 40 hours generally for a positive? Is that time frame generally?
That frame here with us, Bill, yes.
Okay. Anybody here? Okay.
For negatives, it's a 24-hour turnaround. For our positives, it's a little longer. With a urine positive, it would be a little bit longer, too. 48 hours is, I think that's generous, because it takes us a little longer.
Okay, 72 hours or something like that.
Yep.
I think our positives would run maybe up to 72 hours as well.
It goes through the MRO process, and that can sometimes take an extra day or two to verify. So, let me use Sue. Now, which are you testing for with your oral fluid testing program? Is it the standard 5 drugs, marijuana, cocaine, opiates, amphetamine, and PCP, or are you testing for drugs beyond that?
We do marijuana, cocaine, barbiturates, amphetamines, opiates, and ecstasy, and our opiates are an expanded opiate panel, hydrocodone and oxycodone.
Okay. Sean?
Your 5-panel drug screen, Bill.
Okay. Kurt, what's your drug? Okay. Now, point out to our audience as well, as part of the proposed guidelines, is proposing oxycodone and oxymorphone and hydrocodone and hydromorphone to the panel for the oral fluid test, which would translate to urine testing as well. So that's coming the pike one way or the other. Sounds like that would be part of the proposed guidelines for federal testing and then eventually for DOT testing. So we'll see that coming the pipe. And we're almost out of time. I don't want to ask any of you specific pricing questions. In other words, don't tell me how much you pay for a drug test, but how does the cost of your drug testing program compare to urine testing?
About a 10% savings.
With this, how about you, Sean?
So, about 10% savings as well, if not a little bit more, yes, sir.
Okay. Do anything to add to that?
Per test, it's a little bit more costly than a urine test. But if you factor in all the time and everything we've discussed today, I'm sure there's a cost savings. There's a savings that we can't quantify.
Okay. Perfect. Most of the questions that we got from our audience were there are some others that we can't get to at this time. Well, I'll go through and see if there are any others that we didn't get to. If there are any that we didn't get to, those of you in the audience, we will respond to your questions and send that out to everybody. We're out of time, so I don't have time to take you through these next few slides, which I had planned to use as our conclusion. To have them, this is the projected future of oral fluid testing in terms of the volume of current tests that will convert to oral fluid tests, at least projected by SAMHSA. There's a lot of good details in here that I think find very interesting, especially here this slide where you see them, SAMHSA projecting DOT and NRC tests converting to oral fluid. They're estimating, quite a number, 180,000 oral fluid tests converting over. I think if you look at now that's just in the beginning. This slide now shows you where they estimate the volume will be 4 years down the road after implementation. As much as 1.7 million on the DOT side, between 1.7 and 1.9 million between DOT and NRC. And then I took it just a step further and sort of extrapolated that using the non-related volume of drug tests that take place, which are about 75 to 80% of all drug tests are outside of the DOT regulations. And then just show you real quickly, when you get the slides, you'll see the expanded slide deck on the benefits of oral fluid testing. That's at the very bottom of the slide deck. So sort of scan all the way through the slides, and you'll find a lot more information about the benefits. These are all direct quotes right out of the proposed guidelines from SAMHSA. Thank you to Sean, Sue, and Kurt for co-presenting. Thank you also to OraSure and to Red Planet for co-sponsoring today's presentation. And we'll now turn the microphone back over to Jessica.
For all of those with us on the call today, on behalf of OraSure Technologies, we hope that you have found today's presentation informative and helpful. This presentation was recorded, and you will receive instructions informing you how to access the recording. Thank you for your attendance today. This concludes today's webinar.